Hi everyone, my name is Sienna Boyd and I am the new community representative at Rancho Family Medical Group. Today we are here with Dr. Rome Walter at Intaza Coffee in Marietta just to get to know you and get to know Dr. Walter and learn more about his practice. So Dr. Walter, you prefer to go by Dr. Rome, correct?
Yeah, most of my patients call me Dr. Rome.
Okay.
I like the informality, and also just make sure I don't get confused with Dr. Walter Combs.
Oh, true.
He's been around for a while. He's the well-known physician at our clinic. And,
true. Okay, so Dr. Rome.
Yeah.
Can you tell us a little bit about your background, your medical background, education, all of that?
Yeah, sure. Although I was born in Arizona, I kind of grew up in the Central Valley of California, and so I just kind of did the standard thing, the standard childhood. I did a lot of sports.
Yes.
And
any ones in particular?
Yeah, wrestling was my big sport, but I
Okay.
also played football, did a little bit of running or track, but those
Okay.
were the big ones. And stayed really active, like a lot of parents these days. We try to get our kids to be that active. And
Stop watching TV, get out of the
yeah,
house.
I was always outside on my skateboard or BMX bike, and I just don't think I knew any other way. And so
Right.
that is, having children, for some reason, we don't just let them go run around town like, I did. So
Right.
that's a big challenge, I think, for health, actually. But that is my background. And then I realized, though, that I really excelled at science, and I really wanted to do something with that. And it became more clear as I went to college that was going to be medicine.
Wow,
And,
okay.
I loved the science, I loved the discoveries, but I really wasn't going to be a bench scientist and, mixing chemicals or, doing
A chemist.
research.
Okay.
Yeah, I really wanted to have that knowledge and bring it to people.
I love that.
And I think it was partly inspired by just my family growing up, didn't have a lot of health insurance, which was pretty common back then. Not everyone had health insurance. And just seeing some of the medical and mental health things around my family, I thought, boy, it would be nice to have the knowledge to make sure it's not such a struggle and to understand why people were having all these things. So.
And impart that onto others.
Impart that onto others. Now, my family grew up, well, I guess my mother really pushed kind of a natural approach to health.
Okay.
And so she was always giving us aloe vera juice or apple cider vinegar or some other gross thing that was going to fix us.
Yeah.
And so I was just used to that. I was used to that. But, like a lot of busy families, my mom worked, we didn't have the ideal lifestyle as far as nutrition. So there was easy processed food, and then we were going to, fix it all with taking some aloe vera juice, which, hopefully we've moved farther along than that. But that's kind of my background. I was already really in tune to using nature to help people. And when I was in college, that's when I kind of became aware of just kind of the natural health movement, like Dr. Andrew Weil. He was one of the pioneers of medicine that kind of pushed that forward, that we're not going to fix everything with drugs. So even before I went to medical school, I knew that was the route I wanted to take. At this point in my practice, I just try to back up and look at the big picture, be very patient-centered, and work with them.
That's awesome. Can you tell us a little bit more about your education? Where did you go to school?
Yeah, so I went to Midwestern University, which is an osteopathic school, the Arizona College of Osteopathic Medicine. A lot of my patients gravitate to my practice because of that osteopathic or DO background.
Can you tell us more about what osteopathic medicine is? Or at least me, because I'm not sure what that is.
So there can be some confusion about it. Medicine has come a long way in the last 150 years, 100 years. Initially when osteopathic medicine grew out of or developed out of standard traditional medicine, we use the term allopathic medicine or MD medicine. There was obviously a lot that we didn't know, and a lot of the practices, everything from, giving people toxic metals and bleeding to cure infections.
Yeah.
There was a lot of misinformation, and so Dr. Andrew Still, he he really branched out and thought, hey, really pay attention to some underlying fundamentals of health and how people move, their range of motion, their musculoskeletal system, their lymphatic system, all of the things he learned in anatomy. He developed kind of a new branch of medicine that tried to get away from so many of the cures that weren't really helpful back then.
And so this interested you enough to actually go to a school of osteopathic medicine.
I learned about osteopathic medicine when I was an undergrad, and it just seemed like they were really open to the natural approach that I wanted to.
Okay.
In reality, we know now that we don't bleed people for infections, and a lot of osteopathic and allopathic medicine has come together, and there's not a huge difference outside, unless an individual osteopath makes a difference and makes a concerted effort to use their understanding of anatomy and physical medicine. So we do osteopathic manipulative medicine. This is where we do kind of it's almost a branch of kinesiology, where we use the lymphatics, the muscles, the soft tissue, and the joints to restore motion, to restore health, to restore flow in the body. And so that's some additional training outside of the standard sciences that you get in medical school. So that's probably the biggest distinction. But like I said, if you find a good MD or a good DO, then that's the important thing. And not a lot of DOs actually do a lot of the manipulative medicine in their clinic.
Okay.
I do a limited amount. So if they have a lot that needs to be done with our clinic and the way the insurance system works, I don't always do a ton, but I do some, because sometimes it makes a big difference.
Definitely.
And it's simple, and there's no medicine, no drugs involved.
No drugs involved. Very interesting. You had mentioned earlier a little bit more about nutrition as the main guiding force for health. Can you expand on that a little bit?
Yeah. So maybe earlier in my practice, as I went out into the medical world and I had a lot of patients, and I realized that just finding a diagnosis and finding a drug and getting them through my office wasn't really making anybody better, and I was really missing something. That's what I really delved deeper into, a natural approach. In the foundations of medicine, we know that food can be your medicine. But I back then I thought, I have the perfect way to eat and the perfect way to live, and I just got to get my patients to do it all and they'll be fine. And of course,
a lot harder than it seems.
It was a lot harder than it seems, right. And so now my approach is to start where the patients are at. Like, where are you at right now? And can we do better next week? And the answer is always yes, you can do better next week. And so I do get into people's diet. I start with where they're at, and if it's just getting them to eat a more whole food diet away from processed food, then we'll do that. If we can gear towards a more plant-based diet, then we do that. I don't do a lot of extreme diets, except for maybe certain cases targeted to certain conditions, and it's usually short-term, with the hopes that we reset their immune system, reset their health, and so that they can get into kind of a longer-term Mediterranean diet that you hear about, or modified Mediterranean diet, because it has really the most science as far as a general broad approach. And
what I'm hearing is that you take every single one of your patients, you meet them where they're at, and then you're able to prescribe a certain way of eating, or a better way of eating than they're currently doing. Is that correct?
Yeah.
Okay.
And often if I really talk to my patients, and they already have an idea of what they need to do. And so it's better if they come up ultimately with the changes that they want to make.
Okay.
So I might steer them one way or another, or I might say, hey, look, that's good short term, and then let's get into something that's more sustainable.
I love that.
Yeah.
That is awesome. Well, we would also like to know, I'm sure a lot of people are very interested in what you like to do for fun outside of the office.
Yeah, sure. Well, I do have 5 children, and so
I
try to make sure I spend enough time with them. So we do everything from, fun outdoor activities to board games, and just spending one-on-one time with them is good. Now we live in Harveston, so we're always out on bikes around the lake there, or to the sports park to practice some new thing. So I'm involved in a lot of their activities. I really love to read. Even though I try to be engaged for my patients and try to be motivating for them, I'm really an introvert. So I love to just read a classic novel and just take a break.
How would you encourage your patients to stay active?
So I think right now is a critical moment to ask that question. Again, I go back to where they are right now.
Okay.
But I really encourage simplicity. I know a lot of people, they really rely on going to the gym, or they rely on maybe even walking. But I always want to make sure that they're doing something sustainable, something that they can do that doesn't cost money, something that they can do that doesn't require good weather.
Functional.
And
back to your functional
back to
philosophy.
the functional. And so that's usually some kind of indoor calisthenics program. I personally, endorse yoga or Pilates because, you just need a mat and your laptop or your TV or whatever. It doesn't matter what temperature it is. Almost all the services I use are free. They go by advertising if you want to buy their stuff. And I think it's accessible to everybody as long as they have reasonable expectations about how to start slow. Because I think the flexibility is a key to maintaining health long-term and longevity. But I also use really simple programs. Sometimes the patients just don't realize it's not a big deal. It's not doesn't have to be a huge lifestyle or time or money commitment. I'll show them apps that literally, I say, look, it's this simple. You've stressed about really not getting healthy or stressed about not getting in shape like you've always wanted to do and you've always been putting it down the road. Literally just push this button, do these exercises for 30 seconds.
Right.
They're exercises that you and I could do right here.
Right.
Take this chair and do some easy tricep dips. Stand against that wall and do a wall sit. Do some planks to help your core. If you can only do 5 seconds, do 5 seconds, but just do more than you did yesterday.
Do something.
Can you get your core strength tomorrow to avoid that back pain, to avoid you favoring that knee because your core is so strong? And so almost always they realize I've been overthinking this. I've been making it a big deal.
Right.
I just need to get rid of all my excuses and get out on the ground and just strain those muscles, get a little short of breath, get a little uncomfortable. And that's one thing I do stress, because I do have a lot of patients who they want to lose weight, or they want to they want to have more energy, or they want to overcome some of their aches and pains, and they're stuck. Like, I walk and I do my walking faithfully and it doesn't do anything. And I ask them, well, do you get a little short of breath? Do you get uncomfortable? And not really. They don't really get uncomfortable. And it's that edge that I want to take people to. Stay on that edge where where your body has to work a little bit, has to recover a little bit. That's all we're trying to do. We're not trying to make some artificial mark of perfect health or being super in shape. It's you pushing yourself just a little bit.
I like that. It's funny. I've heard a quote before that says, no change happens in your comfort zone. So I love that. I love what I'm hearing is that if you can just do a little bit more than you did the day before, you're one step closer to a goal or one step closer to being even a little bit healthier. So
I really want my patients to immediately recognize that they're up for a change. I don't want them to leave my office and think, okay, I'll look at this paperwork he's giving me, tomorrow or something.
Right.
I want them to literally leave and go to their car and just be thinking, all right, I am going to be different. I'm different right now. I'm going to really think about opening the car and what music I'm going to listen to. I'm going to make these changes because I'm worth it. Anything we can do to be healthier, it's worth it, right? It's worth it. And for whatever time it takes, or getting out of our comfort zone, or sometimes it's just overthrowing the culture of our friends, family, and community that has gotten us used to a certain lifestyle or a certain attitude about how you eat and how you spend time with family and friends, and realizing that you can always take that culture but make it your own, make sure you're healthy.
Very great. You had just mentioned meditation. I know on our new educational library, our free educational library, Choose Health, you had done a meditation course. So we're really excited to learn what that looks like and how to actually meditate with your guided meditation course. If you guys are more interested in learning about health and health education for absolutely free, you can go to youcanchoosehealth.com and learn more from our physicians like Dr. Rome. Well, thank you so much, Dr. Rome, for being here today.
No, it's been great.
So nice to hear about your philosophy and get to know more about you.
Thank you.
Thanks.